Part of the problem is, yeah, in a hospital environment, as we walk through, everyone's phone can have a wireless hotspot on there. How do we know if that's a patient who's just trying to get out and to stream some game somewhere versus, oh, this is an attacker who's trying to burrow in, assess the environment, set up a fake hotspot to try to capture patients' data. That's where, yeah, we definitely have to leverage a suite of technologies, anything from, hey, end user education or informing our folks what to do, all the way to technologies that basically alert the security team that, hey, you've got a persistent device over here that is looking to impersonate the hospital's Wi-Fi, or do other things that could be very suspicious and warrant some of our follow-up action.
Yeah, so what are some other, type of steps folks could use to protect their connected devices, like their medical devices?
Protecting devices, much of that is staying aware of what the current recalls, vulnerabilities are. So many times the manufacturer will put out notices. A lot of times it's just understanding, okay, we've got this notice, we've got this vulnerability. Let's understand what the real world risk is. Some of these are very theoretical risks that, yes, we should get around to it. And some of them are very real world. Hey, yeah, instantly you need to go, you need to disconnect systems or you need to apply patches. So a lot of those are going to be case by case. But there's also a lot of best practices. So if you've got medical devices with exposed USB ports where a patient could reach up and they might just be interested in plugging in a device because they need to charge it and not realizing that might actually be a vector for something to compromise that particular device, or for folks to get curious about what certain things do. Things like hardware, USB blockers, segmentation on the network, very important, as well as keeping those devices up to date with good patches.